Okay, thank you. All right, so welcome everybody. We're excited to have you here. This is a Monday, and boy, is it a Monday. I hope your Monday is going well. My name is Kristen Kidd, and I'm with the Southeast Prevention Technology Transfer Center. We're located in Wake Forest, Wake Forest University in Winston-Salem, North Carolina, and we're really excited about this series. We have a three-part series. Hopefully, all of you have signed up for all three of the webinars, but we're really going to be digging into how to write successful grants. And we're really excited to have Drew here today. Today it's session 1, and we're going to talk about planning for successful grant writing. So I do want you to know that this training is 100% supported by SAMHSA, the Substance Abuse and Mental Health Services Administration. They fund us, but the contents are not necessarily of Drew's are not necessarily represented or endorsed by SAMHSA, HHS, or the US government. So the PTTC network welcomes and celebrates our diverse community of professionals, and we really strive for inclusivity that respects the spectrum of identities and backgrounds of all. An inclusive language, it's the recognition that words matter and that word choice can be used to include or exclude others. And using inclusive language communicates in a way that is respectful and brings everyone into the conversation. And to that end, the PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. Come on, slide deck. Okay, so this is the PTTC network. I think by now everyone is really familiar with a network. If you're not, and you don't live in the Southeast, do know that there is a center. If you are in the United States or any of our territories, you have a PTTC that serves you. We provide free technical assistance and training to the prevention workforce and those who might be doing prevention but don't realize they're doing prevention. We put on lots of webinars, and I'll talk a little bit more about, we have a YouTube page where all of our recordings live. But we are the Southeast PTTC. We serve the navy blue states here on the map, from North Carolina and Kentucky all the way down to Florida and over to Mississippi. And we are housed at Wake Forest University School of Medicine, as I said earlier, in Winston-Salem, North Carolina. And that reminds me, if you haven't already, please find the chat and make sure that you introduce yourself in the chat. Let us know your name, where you're from, and what's one thing you'd like to get out of today's webinar. So go ahead and put that in the chat. Welcome, Callie and Lacey. Oh, Lacey from Catawba Nation Youth Prevention. That's exciting. We're glad to have you all here. So a little bit of housekeeping. Now, whenever you have to leave, this is a 90-minute webinar. If you leave early, if you leave at the very end, when you do leave, you'll probably get the warning, you're going to an external site. That is okay. That is our evaluation, also known as a GIPRA. It's a Governmental Reporting Act. But once you complete the evaluation, which we do look over everything, all your feedback and your comments, and we share it with our speaker, when you're done with that, pause, because this certificate of attendance will download. It may not populate your screen, it may fall into your downloads, but it's there, and you can open the PDF up and type in your name and save as on your computer. A lot of people have problems with that, and if you do, you can reach back out to the Southeast PTTC, and we'll make sure that everybody gets that certificate. But I see people are like rapidly coming into this room. So I will probably repeat some of this at the end, but it is being recorded. When you close out, you'll go to the evaluation. You can complete that. Then when you're done, the certificate will download, but don't do like I do and click out, click out, click out. Take your time because the certificate needs to download. As I said, we have a YouTube page. So the recording of this and most of the other webinars we've done in the past will be found on our YouTube page. You could always just go to YouTube and click on Southeast, or search for Southeast PTTC, and we'll come up. Let's see, at the bottom of our main page, which is pttcnetwork.org/Southeast, there's our newsletter. You can sign up for that at the bottom. That's another area where you can get to our YouTube page. Come on in, Taylor, Randy, Teresa, welcome everybody. Upcoming, the most the closest to us upcoming events are part 2 and part 3 of this webinar series. So part 2 is going to be on June 3rd, and part 3 is on June 10th. And it's a lunch and learn. So for those of us in the Southeast, it's at noon. For the rest of you, I know it's later. And those of you on the West Coast, I know you're wrapping up breakfast. So it is what it is. So with that, I'm going to go ahead and introduce our speaker. Drew Reynolds is the principal consultant at Common Good Data, where he provides data and program evaluation services to nonprofits and the public sector. In his consulting work, he advises organizations on how to use data-driven, very important, data-driven decision-making to design and evaluate effective programs, secure funding, and most importantly, improve community well-being. And while he serves organizations across many sectors, Drew, who is a social worker, has developed an expertise in providing data and program evaluation services for organizations in prevention, mental health, human services, and education. Drew also advises organizations on how to improve data and evaluation activities through a diversity, equity, and inclusive lens that attends to the culturally, linguistically, and racially diverse contexts and the many organizations that he serves. So with that, I'm going to stop my share. And Drew, I'll invite you to find your deck and go ahead and pull it up. Now, I'm going to be monitoring the chat, so if you have any questions or any concerns, you can place them in the chat. And if Drew gives us a pause, I'll ask a question or two, or we can always save them till the end, and I'll make sure that we'll get to as many questions as we have time for.
Here's our agenda for today: identifying and selecting grant opportunities, developing a grant timeline, preparing standard proponents of a grant proposal we'll kind of walk through. And I think we'll spend a lot of time too, just as a bit of an overview of the strategic prevention framework, primarily from a grant writing perspective. So that will be another piece that we add to our presentation today. And then following, or sort of wrapping up here with some discussion of community members, partnerships, written agreements, etc. As I'm presenting, please don't hesitate to just jump in and ask questions in the chat too. I'll be monitoring that as best as I can. And so we should be good to go there. All right. All right, so first on identifying and selecting grant opportunities. So I'm going to talk a little bit about grant opportunities from both federal, state, and local approaches. And I know many of you who are on this call are probably very familiar with grants.gov. And I'm sharing with you 5 different funding lines that show up a lot when it comes to substance use prevention.
I'm going to go downstairs and check to see if we have bread.
And so the first, is the drug-free communities grant opportunity, that DFC. Some of you may actually have a DFC grant opportunity that you're using. And it's a great opportunity to put together a drug-free coalition that focuses on some of those environmental conditions that lead to substance use issues. And so DFC is a great funding line that comes through SAMHSA. Actually, it's now CDC, I believe, is on that side. There's also the Sober Truth of Preventing Underage Drinking, the STOP Act, which is given to DFC grantees. So those two are are often together. We then also have the Partnerships for Success grant opportunity, which is the PFS, which is a great way. I hope focus on the word partnerships in there, because it's really about kind of doing cross-sector work in the same way that DFC is, recognizing that prevention work really can't be done in isolation. And also there were some opportunities that came up during COVID, so it's always good to pay attention when something new is coming through. So some of you may have received or worked with ESSER grants or ARPA grants. ESSER focusing really on school systems, ARPA being a bit more broad. And then lastly, state opioid response. And these are not the only ones that are out there, but they're common ones that tend to show up a lot. And so my recommendation for you is to just familiarize yourself with these. Maybe your organization doesn't currently have one of these funding streams. But if you go on to grants.gov, you can read through some of the notice of funding announcements and get a sense of, hey, is this a grant kind of a good fit for my organization? Is this something that we might try to aim for in the future? Because many of these are recurring, so they may show up next year. So to the point in the chat, yes, ESSER and ARPA funds are ending. Those are a bit more temporary, sorry, given that they came out during COVID. But the other 4, are at least pretty regular. The first 3, I guess, are pretty regular at the moment. So staying on top of that, sometimes funding streams will come, sometimes they'll go. But it's just good to be familiar with them. And in any case, even though the funding lines may change in name or may change in approach, many of the SAMHSA grants follow the same type of format. And so we'll kind of draw a little bit from that in this presentation today so that you'll get a sense a little bit of what that format looks like. So you'll be able to have success really with any grant that you apply to. There's also lots of state resources. I encourage you all to check out. It's not always called the Department of Health and Human Services, but some version of that in your state, whatever that the correct acronym is in your state. Check out their grants page. Certainly block grant fund dollars tend to flow through there as well. So you may be familiar if you're a block grant recipient of those funds as they come through. And I'm giving some examples here in North Carolina because I do a fair amount of work there as well around some other state level initiatives. So sometimes you'll have either your state or an organization that works statewide will provide funding for substance use prevention work. In the case of North Carolina, I think one of them that comes up a lot is the North Carolina Preventing Underage Drinking Initiatives. That grant funding stream is very helpful for a lot of prevention providers in the state. And North Carolina also has Alcohol and Beverage Commission boards. Not every state has one, has these, but there is written into state law that some of the funds from the ABC boards need to be shared with prevention providers. And so sometimes you can seek funding through those types of mechanisms in your state. And then also there's, this one is just another example of a local one, the North Carolina Behavioral Health Initiative. Sometimes universities and other kind of public-private partnerships will come together around a particular problem area and issue grants to local providers to help address issues related to substance use prevention. And then many of you may also be familiar with, because it's gotten a lot of news, opioid settlement funds, which have also been funneling, or sorry, not funneling, but was sort of passed on through state and local jurisdictions to be distributed as a result of opioid settlement, that legal settlement. Those funds are being used to help engage in prevention work. So I share with these just so that these are things to be thinking about and be aware of. Many of you probably already are familiar with them, but those are good places to begin your search for grants in substance use prevention work. Lastly, and I think sometimes we miss this as prevention providers because we focus more on the federal and state grant opportunities, but there's a lot of work that can be done in local communities. You know, if you connect with your local United Way, for example, or connect with a community foundation in your community that is focused on prevention or focused on youth-related activities. Sometimes there's family foundations who have a particular interest in addictions or in substance use prevention. And so you can sometimes find people who are directly in your community who might want to fund something. And what's great about local foundations and other local organizations is that they might fund things that federal dollars or state dollars might prohibit. Something that comes up a lot is you can't fund food if you're trying to do an event or something like that. And you might be able to find other sources that would be a little bit more flexible with how you use the grant dollars. And so having a mix of federal, state, and local can be really helpful as you try to figure out which dollars get kind of plugged into which types of grant activities that your organization is going to be working on. So I know some of you are looking through that toolkit here, and I'm sharing this here as an example because this is a chance where you can identify and select some grant opportunities. And I've got a nice table in there where you can kind of go through the checklist of what I've shared here, drug-free communities grants, STOP, ACT, PFS, and it kind of goes down for state and local as well. And just kind of do a checklist. Hey, these are the ones I currently got. This one is a new opportunity. Maybe, you know, next funding year, in the next year that comes up, you know, maybe the grant opportunity might not be open right now, but maybe it'll be open next year, and I can start to do a little bit of work in planning now to think about, hey, what would it look like if we were to bring a substance use, you know, a prevention type of activity to our community, or what would happen if we decided to start a drug-free coalition, for example. So those are just some good examples of things that you can think about to be able to try and you know, plan out some approaches for your next grant opportunity. So I heard some folks are having some trouble with the toolkit. I'll see if I can find a way to add it in here once we're at the next discussion break. I'll open it up and I'll see if I can find a way to add the PDF or something into the chat so that you can get access to it. Okay, so what I wanted to do here is, I'm sorry, it says where, should say what are some examples of funding sources that have not been shared. So is anybody wants to add some that I have missed? Go ahead and add them into the chat. And I'll stop here to see if I can find ways to add the toolkit into the chat. Does anybody have any other resources? Oh, there we go. Thank you, Melissa. She just dropped a link in there, so you can use that link to download it. Any other big funding streams that I missed, things that you're seeing? Maybe are there some grant funding opportunities that are local or unique to your state, or maybe there's something that is maybe something that's not traditionally seen as a prevention grant? Drop some in the chat if you've got any, or maybe I've covered them all. I guess that's possible.
You did cover quite a few. I do like that you mentioned foundations. I really like the flexibility that foundations afford. And you're right that sometimes you can get funding for things that you can't get from federal dollars. And I don't know if we really take the opportunity to look at those alternatives in the world of prevention. You know, we're so into the federal dollars, but there's so much more out there.
Absolutely. And we have a couple of good ones coming in here too. We've got Garrett Lee Smith, the suicide prevention opportunities in Tennessee. For those who are involved with the Tennessee Highway Safety Office, there's actually a lot of connections that between transportation offices who are trying to reduce alcohol-related crashes. You know, that's a great place that you might be able to find some prevention dollars. HRSA is another good example. HRSA is kind of a larger funding stream that's really focused on trying to improve health workforce, but you might be eligible to, whether it's workforce training or other ways of supporting prevention work, you might be able to use that. Tribal opioid response rate, that's a great example. There's lots of opportunities that focus specifically on tribal groups as well. So I'm really glad, Melanie, that you mentioned that, because there's a number of grant funding streams that make that a priority. Some related to the criminal justice system. Yeah, you can get some through DOJ sometimes. And, you know, a lot of times with those two, it really helps when you partner with another organization who's doing justice related work in your community. And you can put together some really compelling proposals that show how you and a partner organization can kind of tag team on related issues, because we know that substance use prevention is related to justice involvement. Other ones here, excellent. These are some great examples. National Center for Fatality Review and Prevention. Oh, awesome. These are great. So thank you all for sharing some of those. And I know it's good as a community to try to share opportunities and ideas with folks so we all can continue to grow and expand our knowledge together. So once you've identified some key grants to tackle, I recommend putting together a grants timeline. And you can do this as an organization with a bunch of different grants, but I'm going to walk through it, what an example timeline it might look like for a single grant that you're working on. And you'll see here with my first step is that 8 weeks out for you to review requirements and eligibility. Now, I know that doesn't always happen with every person that I've worked with. Sometimes you find out a grant opportunity and you realize it's due in 2 weeks and you're scrambling, right? But in an ideal scenario, if you have a new grant opportunity that's coming up, especially if it's a federal or state one because they're fairly involved, it's always good to get started as soon as you can. The second you know that funding announcement's coming out, give yourself that 8 to 12 weeks to really think out and plan through what this grant can be. And I will tell you, those who start earlier always have better grant submissions when the timing is done. So starting early, review those requirements and eligibility. It's always good to make sure. I've worked with some organizations and we spent a lot of time on a grant and submitted it, and then we realized we didn't get it just because we weren't eligible. So always make sure that you check the understanding of the eligibility requirements. It's actually not always that easy. Sometimes it can be a little bit confusing. So if you've got someone in your organization who has experience working with some of these grants to help you look through that eligibility section and say, hey, does this fiscal years line up, and does the type of organization I am line up? That can be a helpful thing and save you trouble, because you don't want to write a big grant if you don't have to, right? If it's not something you're eligible for. At that time, too, you really want to focus on putting together some type of timeline or a checklist if you can. And I know that you have an example of that in the toolkit that was shared with you about what that kind of looks like. Just to be able to say, like, what are the things you need to do to be able to be ready by submission date? And, each grant is different, so you can put together kind of like a checklist that works back from the date of submission. And I'll have an example in that toolkit that you can use as well, just as a generic kind of like, these are typical things that you see in a grant that you can use for that checklist. I always think too, in the second you see a grant opportunity coming through, one thing that I look forward to is like, who are the people we need at the table to write the best grant? Because if you try to bring on a partner a week before a grant's due, they don't have time to review it and like sign on or give you a letter of commitment or say that they're going to do things or work out difficult budget conversations, right? There's not time for any of that. So if you want to build a really strong, good partnership with another organization, which many of these grants really require, that's one of the first things that I think you should focus on, even before you start writing grant narratives and goals. You'll get to that, focus on that partnership first, figure out who are the other partners in your network that you want to be working with when you're completing a grant application. Now you might say, hey, Drew, look, I don't know that many partners in my community. Like, who would I even get started working with? Or maybe there's like one other person, but we don't really work that well together. What do I do? And that's why I say grant writing is, even though I say 8 weeks out here, grant writing is something you're kind of constantly doing. And it's a part of a broader strategy of you thinking about how to increase sort of the knowledge and understanding of your organization, to advocate for yourself as an organizational leader, so that you're constantly doing work that's going to benefit your grant writing. So a good example of this would be like, hey, I might be interested in putting together a DFC coalition grant where I want to be able to bring a coalition to my community. Now I know, because I read through last year's Notice of Funding Award or announcement, that I have to have a relationship with my local law enforcement organizations, or I have to have a relationship with someone in the business community, or I have to have a relationship with my school district. So it gives you time to say, hey, I might be applying for this grant or even see next year's funding announcement for another 6 months, but I can spend time now building my network and reaching out to people and saying, hey, I'm not sure what the future may bring, but we might have something in common, and we might have some way that we can build a partnership together. So always be thinking about who are the other folks in your community that you can be partnering with to tackle some really cool substance use prevention projects. Then at about 8 weeks, build your core team, find out the folks in your organization who you can count on to get you to the finish line. And you know who those people are, those people who are organized or good writers, etc. Build those people together so you can put this grant application together. A lot of times too, there's a pre-application workshop, and this is typically the case for federal and state where they're required oftentimes to provide some type of workshop that you can attend to ask questions and to hear from the grant makers, a little bit about their funding stream. And I go to those things and I learn something that I missed in the funding announcement every time. So if you have the availability, most of them are on Zoom now, so you don't have to travel to get them, which is great. So you can really go and attend these workshops and gather more information. And you can also see who else is applying, because a lot of times you'll see them in the chat or in the participants. So you get a kind of a sense of who's out there, what's the interest for the grant, what are people talking about. So I highly recommend those pre-app workshops. So then between 6 and 8 weeks out, I recommend doing some brainstorming and drafting goals. And the key here when I talk about brainstorming and drafting goals is sometimes we think about grants as, okay, hey, what I need to do is start plugging in what I'm already doing. And there's going to be a place for that. You're always building from your strengths as an organization. But the reason why we talk about partnerships first in week 8 and then 6 to 8 weeks starting to draft goals is because if you're doing a true partnership, a true collaboration with another organization, which again, many of these grants require, then it should require some joint work when you're putting together goals and objectives. Because if just your organization is writing all the goals and objectives and another organization is just along for the ride, they're going to be along for the ride when you implement. And you're going to be wondering, why am I doing all the work? Why is my partnership not working out as well as it should? Well, because it wasn't a partnership from the start. So start here, bring in your team and say, hey, we have this shared goal. The objectives of this grant are to accomplish this broad substance use prevention objective. How does this work in our community? What is your organization doing, potential partner? And what do you think we need to do? This is what we're doing. And maybe there's somebody else that we're missing that we need to bring to the table, right? So that 6 to 8 weeks time is a really good time to start talking through what is it you want to accomplish as a group together. I was actually on a really great call recently around some folks who were going for a larger federal grant, and it brought together people who had not worked together before. It was a prevention provider, it was somebody from a local university, and it was somebody from the justice system and the teen courts. Those organizations had not worked together before, but because they started 6 to 8 weeks out, there was a lot of time that they had to say, okay, what is it that you do? What is it that we do to put together some shared goals and objectives together? Okay, 4 to 6 weeks out, you want to start thinking a little bit about your drafting project narrative. So this is where all the writing work starts to get onto the page, right? You spend some time brainstorming, getting some ideas together. Now we're starting to put together that project narrative. And as I shared earlier in this presentation, we're going to have our next workshop that focuses just on that. how to write a strong project narrative. And typically they all include some version of a problem statement, some measurable objectives or goals, some activities, and a budget. Every grant includes some version of that. They might use different words, but that's what you'll be having there. And the key there when you're doing that is that there's a temptation sometimes, I think, for folks to, can you all hear me okay? I know someone said they're losing audio. Okay, cool. We're still good. All right, I just want to make sure. When you're working on that project narrative, and I'll talk about quite a bit, is to check for alignment. Because a lot of times there's a temptation to say, okay, we'll have our grant writer take one section, we're going to have our programs person take one section, we'll have another direct staff member take this thing, and then we'll have our CFO, our budget person take on the budget, or maybe our development officer, right? And then you put it all together, and if you read it from start to finish, there's activities in the program that are not funded in the budget. There's somebody's writing a problem statement that's really broad, but doesn't actually relate to the actual intervention that was proposed, right? So you lack sometimes alignment across those things. So the key thing here too is to make sure that all the people who are working on these different aspects of the project narrative are working together and have a shared understanding of what the goals are and what those key activities that are going to be funded by the grant are going to be. It's a good time too, 4 to 6 weeks out, to start talking a little bit about evaluation and consent documentation. I put that in there because that can be, especially on the federal grants where they're really asking for a lot more information on that up front, it can be kind of daunting to say like, hey, I've got to put together all the surveys that we're going to do for this, pre-post surveys or focus group protocols and consent documentation when you're only a week or so out. So sometimes it's good to at least have an eye on this and maybe get started on it earlier on. Then 2 to 4 weeks out, finalize that project narrative section, finalize your letters of commitment. And typically you'll have some version of that if you're doing a partnership, which is, there's a lead organization who's going to be the fiscal sponsor for the grant, but there's also going to be some type of organization that's saying, hey, I commit to do this. I commit to hosting these youth activities, in my church. I hope to help support in-kind contributions in this way, right? Those types of things you'll see coming through, and it's good to try to finalize some of those letter of commitment and attachment documents in those 2 to 4 weeks out. I'll talk a little bit more about that later in this presentation as well. And then here it's a good time also to include bio sketches and resumes and key descriptions of staff. I know the word bio sketches can sound kind of intimidating. You'll see that sometimes on federal grants. And it really just means resume and a little bit about what you do. So don't let that intimidate you too much. But it's a term that comes from more of the researchy NIH side of things. So that's where that term comes from. But what you basically want to do is just say, hey, these are the people who are going to work on the grant, and this is why we think they're well qualified to do so. And how you put that together, meeting the grant requirements, I think they usually are pretty flexible on that. Lastly, 0 to 2 weeks out, you want to start finalizing those documents, completing a full review by your team, and resolving outstanding issues. This is a big one. Lots of times we're scrambling so much just to get the grant turned in that we don't take time to actually review it. And this is where you want to catch things, like having 2 or 3 different people read the grant from start to finish really helps to make sure that you're not missing something that you might have otherwise missed, that you're not forgetting about an eligibility requirement, about a document that was required that we haven't yet put together, or maybe there's a disagreement over a budget item or a goal that you put together with another organization. So it's really important to have that full review prior to submitting. Okay, lastly, you see over here on the left, I have sidewise here written, recommendation, meet once a week with the grant team. I think that you might meet more regularly with like maybe 1 or 2 people to kind of get stuff done, but I think that you should have a meeting once a week with all of the partners on the grants who are able to attend. So if you've got someone, you got maybe 2 or 3 different organizations coming together, the key members of those organizations should get together at least weekly to put together this grant opportunity. So that's a big commitment, like as I shared here, we got 8 weeks out, meeting once a week. You might that's a lot to do. But trust me, you put that time in and you'll be much more successful in getting those grant awards. And so this is kind of ways that you can kind of build in that time, finding ways in your schedule to build in the time to be able to put together this calendar for your approach to writing grants. All right, so some key points. Start early. Making sure that you're prioritizing what comes first. Again, as I shared from the beginning, prioritize your partnerships in your letters of commitment. That's the hardest thing, bringing those folks in. And as Kristen mentioned in the chat too, partners that include strong community voice, making sure that the partners you have at the table are representative of the communities that you're serving in particular. Really important to prioritize early on. Identifying goals and objectives as early as you can. It's not always easy to do. Sometimes they take a long time to write, but to the extent that you're able to do so, get those on paper as quick as you can. And then also talking budget and hard stuff. And sometimes it can feel uncomfortable to talk money. And we have a kind of a bit of a taboo about that in our society. And I understand that. It can make me uncomfortable sometimes too when you're trying to figure that out. But every time that I've told myself, hey, Drew, look, this is a hard conversation, but you should just have it now. Just ask the question now. And it always goes better than I thought it otherwise would. So, hey, who are we actually, what staff lines are we actually going to fund with this? And if there's a partner coming on who's committing to something like, what share of this funding are they going to be able to realistically receive to be able to implement the project on their end? And I think the more you have those conversations clear up front, the less hard feelings you have in the week prior to submitting when someone feels like, hey, maybe my organization wasn't well represented in this grant. And we don't want that feeling, especially when you have a big grant coming through that's going to require a lot of work and implementation on the back end. So having those conversations early is an important thing to do. All right, so for those of you who received the toolkit, and again, thanks again for dropping the link in there into the chat. Here's an example of that grant's timeline. I have just kind of 8 and 6 weeks and 4 here, but you'll see it's kind of a full page line that just talks a little bit about your week, when that should be happening, what are the key activities, people responsible, and whether or not it's been completed. So you can use this as a checklist when you're putting together your grants, just to kind of like use as just a way to make sure that you're on top of everything. And it might not be that you have to do every one of these items for every grant. Every grant's different, so you won't necessarily need it, right? But it gives you a chance here to be able to just kind of think through and make sure, hey, I want to make sure I haven't missed something. So anyways, I hope that you find that useful to use that checklist when you're putting together your grant proposals. All right. So next, step 3, preparing the components of a grant proposal. All right, so what actually goes into a grant, right? And you have, I think, really 3 main kind of buckets, or at least that's how I think about it when I look at many of the funding announcements that I see. Is you're going to have some kind of project narrative where you're writing all the text of what you're going to do. You're going to have a budget and a set of budget budget narrative, and oftentimes a template that they give you to complete. Sometimes that'll include some information on financials, and then some attachments. And when you're taking on these different components, the key thing to think about is that the project narrative is kind of where a lot of your thinking is, and it takes a lot of time to put that together. Your budget is going to flow from the narrative, right? So you have to know what your activities are going to be and strategies are going to be able to write a budget that's going to match that. So those two kind of go hand in hand. I mentioned the attachments here because sometimes they get lost in a grant application, and then all of a sudden you're realizing at the last minute, like, oh shoot, we're supposed to have some staff resumes from 4 people. Oh shoot, we don't have our letters of support commitment, or what happened to our 501c3 documentation? I know it's somewhere. I got to find it. So a consent documentation too around for program participation or evaluation in data collection tools. Those can be kind of tricky to put together at the last minute. So those are things you want to be paying attention to. What's great is that a lot of these you can prep in advance. So like before a grant even comes out, you can have a lot of these things more or less together. It maybe just takes a handful of minutes to update them and put them together so that you're able to then have them ready for when the grant is put together. Coming back to the project narratives, again, I kind of talked a little bit about the 4 or 5 key areas. You'll see a problem description, goals, and objectives. And again, we'll talk about this in more detail in 2 weeks. But the key there also is always seeing that alignment between items 1 through 5. So, okay. As I alluded to earlier, I think it's a good idea to be thinking a little bit about putting together your own kind of toolkit. I'm shared one with you of things you can fill out for this presentation, but you might want to have kind of like a packet of just stuff that you have pre-written and ready to go that you can use for any grant writing opportunity. And for folks who are in the grant writing profession, they always have this. And I think the organizations that I know who knock out grants pretty regularly have these core things that aren't going to change that much already written and put together. Things like your mission and vision, an about of your organization, so who you are and a little bit about the history of your organization, key successes of your organization, things you've accomplished. I always think it's something is a really good idea that I'm not always good at actually practicing myself, is actually writing down your wins. Like every time that you've done something as an organization that was a success, you put together an amazing event, you had a program that just knocked it out of the park, you built a new collaboration or partnership that's super successful. Any of those kind of things, don't forget to write them down. To the extent that you're able to, you really want to be able to have those kind of wins already ready to go. So then when you're writing about the success of your organization, you'll be able to see that written out in here. So here's some good questions that I kind of put together in that toolkit. So, organization's mission and vision, history of your organization, size and scope, and maybe you'll find it easier to hold this digitally in a document that you create for yourself, but I just wanted to have it together in this kind of format so you can jot some notes throughout this presentation. And here you'll see under the about, history of your organization and also successes you've had. And this is where we don't want to be, you don't want to be over exaggerating, but it's also important not to be too modest, right? The grant makers really want to know where you've had success. Where have you had an opportunity to show that you have used grant funds in the past and been successful, right? Because a grant maker who's trying to say, hey, we're going to spend some funds, we want to look for those organizations who have a proven track record of success. And so the degree to which you're able to document that in your grant proposals, it can be really helpful in leading to success down the line. All right. Next one, building a team. Okay. So I talked a little bit before is who are the people that you need to bring together? What is the kind of organization or set of people who are going to help you be successful? And I've put together a bit of a list here, and this is not complete by any means, but I think that when you're thinking internally to yourself, these are the folks that you really want to be thinking about as bringing on a grant writing team. So first you're going to have your program staff, and sometimes you'll have someone who's managing, or sometimes you'll have frontline staff. I always think that I put staff here first because I always believe that the people who are closest to the work often have the most insightful things to share about it. So when you've got someone who says like, hey, I know what is and isn't working on a day-to-day basis, having those voices inform your grant writing can be so, so important. Sometimes in organizations, I'm not saying it's in yours, but sometimes in organizations, there can be almost this disconnect between folks who are on the grant writing and development side of work and those who are program staff. And if those folks aren't talking well together and development goes out and writes a grant, but it has nothing to do with what program staff are doing, you'll run into problems down the line. So always, I think, beginning with folks who are closest to the challenge, to the problem, who can be able to help inform that grant writing approach. You want to have some administrators involved as well, executive director, CFO, fundraising, and grant writing. You may have different versions of this. Sometimes this is just one person in your organization. Sometimes this is 3 or 4 people in your organization. But having someone from an administrative side, I think kind of walking a grant through from start to finish can be extremely helpful. I've included volunteers and board members. For those of you who are nonprofits, you may have an opportunity to engage your board members on some grant writing work. And honestly, a lot of board members, they really want to help out in some kind of way, but they don't always know how. And some of them who are good writers, who are good strategic thinkers, could actually use their skill sets in really positive ways to help you gain the funds that you need as an organization to implement your programs. So it doesn't work for everybody, but sometimes you can engage board members in a way, even if they're not doing the actual writing, just to think strategically about how to walk through writing a new big grant proposal. I really recommend engaging board members on it. Even if you don't have them write it at all, just the fact that they're aware that you're applying for these grants, for those executive directors out there who know they're going to be evaluated by their board, it's just good to know that they see you doing the work and they see you actively going out there and seeking the financial support you need to be successful as an organization. I've seen a lot of volunteer grant writers who do great work for organizations. It can be tricky. I don't recommend having a volunteer be your point person for a grant opportunity. I think those tend to not be successful because the volunteers have other commitments, honestly, and they also may not have experience working with these types of grants. So I don't recommend bringing them on as a point person, but where volunteers can be hugely important is they can help you get connected to other constituents and external stakeholders who might be helpful in writing a grant. And I'll talk about that in the next slide, some of those external folks. Lastly, you may want to bring on some consultants. There are folks who do grant writing for a living. There are folks who do fundraising for a living. There's some folks who do evaluation. I'm one of those for a living. And they can kind of help you think through some of the aspects of the grant related to each of those topics that can be helpful. They're not needed to write grants by any means, but may be helpful in your organization as you're trying to get from start to finish. Then you also have external organizations, right? And I've got a list here of some different examples of organizations that you can build relationships with that may be helpful when you're writing your substance use prevention grants. So certainly you've got your other folks who are doing the substance use prevention and mental health work, right? You've got also community-based organizations who might be doing other things, but are really well connected to the communities you serve. The faith-based organizations can be engaged to help implement programs and activities. Law enforcement, courts, and judicial system can also be engaged to build partnerships around prevention work. School districts, youth and family organizations, business community, cultural groups, all these different organizations can be really helpful to partner with on some of these grants. And so in the same way on the last slide where we have these internal staff here for yourself, what you want to do is look for what are the staff members of those respective organizations that can help you to really write this grant effectively and very well. Now, I don't have it explicitly on here, but as Kristen mentioned earlier, you want to incorporate community voice in some capacity. And in some cases, it may be appropriate to have, for example, the recipients of services of your organization have an input on your on how you're writing grants in the future. Members of the community, broadly speaking, who aren't connected to an organization, but who really understand the population that you serve. Maybe it's somebody who speaks a different language than English. Maybe it's somebody who comes from a cultural tradition that's maybe not as well represented among your organization. That can be a really helpful person to bring on as well to be able to do that work effectively. Somebody mentioned tribal grants earlier here, so I should have probably more explicitly mentioned tribes as well, and having the different organizational units within a tribe be participants in the grant writing process, I think can be really important as well. So always thinking about who are those folks in the internal and external that you need to bring a grant across the finish line. Now, actually, before I get to this one, I do want to mention too, though, that you do have all these different people you want to engage, but typically it's only a handful of people who really get a grant written, like who actually do the grant writing aspects and the hard work of figuring out what goes into a budget, figuring out what goes into your goals and objectives and how you're going to write them, putting together all those attachments, right? So I do think that even though you're engaging all these other stakeholders, you want a core group, a small team that's going to be able to meet regularly and help get it across the finish line. So for discussion, to mix it up so I'm not talking too much at you for 90 straight minutes, I want to ask the group also, what are some examples of innovative partnerships with external stakeholders from your own practice? So I shared a few here, and maybe there are others out there that has some good recommendations. Brandy actually has a great recommendation here. Also, your local public health department. That's a great idea because many counties have or state organizations are going to have ways to connect you to resources or opportunities that can be really, really helpful. One thing I love public health departments for is that they oftentimes have local data on health-related topics, and a lot of times substance use prevention-related topics. They may be connected already and have a good understanding, for example, the prevalence of vaping or marijuana or alcohol use in your community. Or they may have other information that can be useful when you're writing a grant application, like, for example, the number of individuals in the community who are living without insurance or who do not have access to culturally responsive or tailored programs that would help them develop the skill sets and the social and emotional skills needed to be able to prevent the onset of substance use in the long run, right? Some other good examples here, we've got some YMCA is absolutely great organization working with youth and really a great partner to work with when you're trying to implement programs. Oh, awesome, cool, yeah. So the Overdose to Action Grant, awesome. Neighborhood associations, absolutely. Organizations that are closest to the folks you serve can sometimes be the best people to bring on to a grant. Schools, faith community, absolutely. Ooh, veteran groups, I like that one a lot. Thanks, Madison. Because in many cases, you've got, the key is what are the organizations that already have existing networks and may be able to engage with and communicate with members of the community that maybe you haven't worked with traditionally. Libraries, fantastic. Oh, libraries is such a good one. I just listened to a really great podcast that was all about libraries and the work that they provide. It's fantastic. Kiwanis groups, excellent. Housing development, hospitality organizations, DHR. Ooh, media, that's interesting too, you know, because when you have an opportunity, I worked with one organization that partnered with a local radio station to put together like a youth radio show. Like, what a cool idea, right? So media, Lori, that's a great example. Other coalitions focused on youth, excellent. Oh yeah, National Alliance of Mental Illness, perfect. EMS, ooh, that's a good one. Working with health providers directly, community navigators, excellent. Well, thank you all for these recommendations. These are fantastic. I appreciate that. It's good to share the knowledge so we can all kind of continue to expand our understanding and knowledge. Now, when you're bringing folks together, right? So say you've got your internal team put together, you've got external organizations that you can partner with together, then you're going to have this kind of brainstorming phase, right? And I think some questions to ask yourself when you're doing this brainstorming work is always to ask your question, what does the community need, right? And sometimes we get stuck as providers, and I've done this myself. So I will say I'm one of the first people to do this, to think, okay, this is a program or service we offer. Let's write a grant to fund that program. And like, yes, and a lot of times you're going to be thinking that way, like, how do I fund the stuff that I'm already working on and doing? But it can be helpful in the grant writing process, I think, to sometimes unearth some of those assumptions about the work you do. Because maybe you're offering a great program and maybe it is successful, but maybe you're missing something, right? A good example of this is to say, hey, we offer all of our programs, but these great prevention programs are awesome, but we are not engaging at all members of our immigrant communities or Spanish-speaking communities, et cetera, or French-speaking, right? So we have, or, you know, there's so many different cultural groups, right? So maybe what you're doing a great job already offering something, but maybe where the work really needs to be done is with something that stretches you as an organization and maybe understands community needs in a different way. And to Kristen's point earlier, when you engage community members early in that process, build those partnerships and have voices at the table, but you can also start to see what are the things you may be missing. Right? Now, the next thing too is to think a little bit about what funders require. So this is one of those things where I think that sometimes we have to make sure that the grant is really going to fit what we want to do. And sometimes we have an idea like, hey, this is what we want to accomplish, this is what it's going to work, and the grant really isn't set up well to fund that kind of work. And so you just have to be able to say, hey, I'm going to put this in a box over here, and I'm going to come back to it when I find a grant opportunity that will fund it because it's important to me and our organization. But then I'm going to go back and look and say, what does this grant opportunity want me to do? And a lot of times I've actually found that funder requirements, sometimes they can be frustrating. You know, maybe someone's like, oh man, I wish I could fund food. You know, it's like as a budget item, right? Or, hey, I wish I could do this one thing that I just can't do with this grant. But what I've actually found in funder requirements is I try to phrase them as opportunities, right? A good example of this is the Drug-Free Communities Grant. And they say, hey, you're building a coalition, you need 12 sectors represented, and you need to engage your local law enforcement, and you need to engage someone from the business community, and you need to engage your school leaders. And you need to engage folks from civic organizations like Kiwanis or other, maybe other types of organizations. And when you're doing that and building that coalition, it forces you to maybe work with someone you haven't worked with before, right? So some of those funder requirements, I think, can be helpful and stretch us as organizations. So try to, as you see them as requirements, is a checkbox to check off. On the other hand, it might be helpful to think about them as opportunities. How can this help you stretch and grow your organization in a way that maybe you haven't done in the past, right? What are you already doing? So good, always building from using a strengths-based lens, right? A lot of the solutions are going to come from what people are already doing. So what are you doing? What are your partners already doing? And how can those existing things that you know are working in a community be enhanced through a grant? To be able to provide strong prevention work. Sometimes it's also good. I love to ask folks that I work with sometimes, like, what would you do if you had unlimited resources or unlimited partnerships? Like, what would your amazing thing work do? Because sometimes we get caught doing the work so much and we get caught so stuck in kind of our existing programs, existing funding restrictions that we kind of almost forget to dream a a little bit about what a really cool prevention space might look like. What if you could completely do it differently? Like, and erase all the assumptions about, oh, we can't reach that many youth, or, oh, I don't know if we've engaged that community very well in the past, or, oh, we tried that communication campaign and it fell flat. Like, what if you just took all those assumptions about things that didn't work and just erased them, just for a minute? What new things might emerge? So I encourage you to take that time early in the process of writing a grant to allow yourself to dream just a little bit, not getting completely, completely infeasible or anything like that, but at least a little bit. All right, so then who actually writes your grant? Coming back to that question of like, how do you actually get this across the finish line? I think that having a core group of folks on your team who can really take that grant from 8 weeks out to finish line and have all those things put together. I have found that it's folks with these 5 skill sets who are really good at being able to get those things put together. So someone who's a good writer, someone who's a good strategic thinker, someone who can kind of think in the big and the small at the same time, someone who is analytic and someone who can go through a 30-page funding announcement and really be able to break down what the requirements are and what you need to accomplish as an organization. Someone who's a good leader and who can bring people together who haven't worked together before to be able to accomplish a shared task. And then, of course, folks who are organized. Now, not everybody has to have all these skill sets. And in fact, most people don't. Even though we all would love to say that we have all 5 of these, I would say that I do not have them all. And I suspect that's probably the case for folks in your organization too, right? So that's where the team part comes in. But look for these skill sets when you're looking for someone to write a grant. And I would say, like, if you're bringing someone and maybe writing isn't their best thing, pair them with someone who is a good writer so that they can work together to get a grant together. Maybe you've got someone who's a good writer, but they don't know anything about the community you serve. Maybe they started 3 weeks ago and they're just trying to figure things out, right? And they need someone with some experience work in the field to be able to inform them in that writing. So again, thinking about pairing skill sets, bringing together with diverse backgrounds, diverse skill sets to be able to bring that grant across the finish line. And it should include some folks who are from your organization internal, but also somebody who's maybe outside to be able to complete that. All right. So on the toolkit that's been shared with you, there's also kind of a place where you can just write down some ideas about who you might work with. I have some examples here of who you might want to include and listing those responsibilities. Sometimes this might be a little bit formal. I think a lot of organizations do this informally, but don't necessarily write it all down. But I just have it written here because maybe it would be helpful for you to just kind of write and jot those things down. Because when you see all the people listed here and their responsibilities, and then you come back to these skill sets, you can say, hey, maybe we're missing somebody with a particular skill here to write this grant, right? Maybe there's somebody else we need to bring in the team. I've worked with an organization, who said like, hey, we want to do these great new programs serving this new group that we haven't worked with before. And it's like, okay, yeah, so let's do that, but let's bring a Spanish speaker on board, and have them help you write the grant. Let's bring on somebody who's got more experience working with that particular group so that you can do that work well. Oh, this is cool. So Sarah asked, a list of skills needed to write a grant. What are your tips for organizations working with fewer staff members? So that's probably true for many of you, right? Because I'm talking about this like maybe you've got like 10 people to work with, and the reality is you probably don't. Maybe you've got 1 or 2 people that you can work with. And I would say then is for these skill sets back here, assess where you currently are. And maybe you're that person in that organization who's writing, you say like, hey, I'm not sure that I'm a decent writer, but I sometimes struggle, with one of these other skill sets perhaps, right? So maybe then that's kind of a goal to set for yourself professionally and say like, hey, what are some of the types of professional development opportunities that I can do to develop and enhance this skill set? Working with what you've already got and helping support people in your organization to gain the skills they need to be able to write them. And, to your point, Sarah, I want to emphasize you're not alone. I write this I'm writing and sharing a lot of this in an ideal sense, right? I say, start a grant 8 weeks out. A lot of times it doesn't happen, bring together a team that has all these diverse skill sets. Sometimes you don't have it, right? So you have to try to do the best that you can with what you do have and place your strengths. But know too that as I'm sharing this with you, my job as a person who's sharing a 90-minute workshop with you is to challenge you and say, hey, these are areas that maybe you're missing some skill sets that are going to help you write better grants. So take some time to brainstorm and think about what it might be to build those skill sets in your group to be able to put it together. Yeah, we have a comment from the group too that talks about like, hey, I can find things, but putting it all in words can be really hard. That's true. I'm curious to see what will happen with AI with that. Maybe that will help some folks. I know like, I've not used it personally. I'm not really sure what grant requirements are going to say around AI use, but it can be hard. To writing for grants is a very unique and challenging skill set. But I think acknowledging that is really important to say like, it's a unique skill. It's something that you can work on professionally. Sometimes when you find people who have that skill set, like keeping them in your organization and hiring them to the extent that you can is great too, to be able to maintain those skills. Great comments here. This is great. All right, so let's go a little bit into the strategic prevention framework. So many of you have seen this before. Maybe it's new to you. Maybe you've been doing this for 10, 20 years and you know the SPF left and right. So I know that folks are going to come to this from a lot of backgrounds. So I apologize if some of this is very familiar to many of you. But I do want to talk a little bit about it as we're getting started because it's so important to be able to use this framework really in everything that you do. And I think that the SPF, and when it's used to its best capacity, is almost like a way of thinking. More so than like a document or like a checklist of things, right? It's informing everything that you do, and that you use that framework to kind of always be thinking about, hey, how does my assessment, capacity, planning, implementation, evaluation, how does that all work together along with sustainability and cultural competence for me to be able to do effective prevention work, right? So referencing it is important. I do think it's important to reference it specifically in your grant narrative, especially if you're applying to a SAMHSA grant, like definitely there. But I think in other places it can be really helpful too, right? One thing that I think comes up a lot is this question around capacity and planning, right? Sometimes we think that we just have to write a grant and then just go straight into implementation. And maybe you kind of say like, hey, we know that there's this problem in our community. This came up a lot with vaping, right? So vaping was a new emerging challenge in the last 5 to 8 years. And as vaping came onto the kind of prevention space, and we were dealing with a new substance that we didn't know as much about, like the temptation can be like, just implement a program, like just find something and do something about it. But maybe what you need to do is just to kind of work on capacity and planning. Hey, we need to approach our logic model differently here. Hey, we need to do a new community assessment because we don't really understand the scope of this problem in our community. Maybe you have anecdotal information about, for example, drug overdose deaths or car accidents, but you don't really have a sense of how opioids or alcohol are truly affecting your community on a local level. So using the strategic prevention work can remind us that we don't have to just grab go write a grant and then implement, that we can spend time thinking about what capacity do we need in our organization to accomplish this challenge? What planning efforts do I need to fund? Like, can I ask for funds to engage the community in a town hall, right? So I can gather more information about an emerging substance use challenge. I think also too that it's important not to over obsess about assessment because with every single grant, it's like, well, you got to do another assessment. And sometimes you're going to feel like, look, I've been assessing like every year for the last 10 years. I think we have a pretty good handle on the problem. And if that's your organization, for those of you who are more experienced in the field, like I think do what's required for the grant, You just have to be able to think about like, hey, look, this is what we already know. This is the data that we're already collecting. Maybe you already have kind of an ongoing assessment process, which is super great. Maybe you got a local drug survey, or you do key informant interviews and focus groups on a regular basis so that you really are on top of your community. That way you don't have to feel like you're reinventing the wheel when doing a whole new assessment process each time you're doing it. And know that you guys really are experts in your communities and have some assurance in knowing that you really can write from a position of expertise. You know your community better than the grant maker does in most cases. So write about it and just tell them, and I think they'll reward you for that. Interesting. Planning has not been accessible in the past. Yes, and this is where I think paying attention, like really digging into the funding announcement. Some funders are really going to want you to say like, hey, you need to submit your planning work already. I want to see a logic model with your application, right? You might see that with some grants. And so they want the planning work done first, and then you go into implementation. And then there are going to be others that are really around capacity that says, hey, this is a new and emerging challenge. Like, go find out what's going on. So that way, when we're funding a program, we know that we're funding the right thing. So I think it really kind of depends a little bit on the nature of the organization. And you'll see, like, to your point, Stephanie, that Samsung's going to, you'll see changes in emphasis over time as you're in this field over time, right? On what you might see expected. Always ask for capacity funds. I think it's a great opportunity. If you can do it, ask for capacity funds. And it's not just staff. Sometimes it's the ability to host a town hall or engage your community in a new way. But thinking about what would it take to be able to, have the capacity needed to run your organization. Maybe you can get some of those core things funded, like access to survey software or access to being able to pay for a website domain and hosting that website for a year. These things can be asked for and are great things to think about. Building and planning activities, logic model review, we talked about that a little bit. Implementation. Oh yeah, and we'll talk a little bit about this, especially in 2 weeks, but I really do think that evaluation and your use of data is going to separate the good from great applications. And so we'll talk a little bit about good ways to use data and ways to really kind of have your applications shine. All right, so I've kind of created a bit of a checklist for you all that is going to walk through a little bit of the things to be thinking about from an SPF perspective. Next week, we'll put it actually into the format of a problem statement and goals and objectives and whatnot. But for now, we'll focus just on the SPF. So first on the checklist is going to be focusing on assessments. So assessing the problem, that sort of what, how often, where, and who of the challenge or the problem. And I think, and this is one of those situations, particularly in prevention work, where a really strong understanding of geography and of community is really important, right? So where is it that you are specifically serving? What zip codes, what census tracts, right? Which cultural groups or communities are you working with and engaging? If you're working with a tribal group, talking about that, what is the unique circumstances facing that tribal group? So these are the kind of things you want to include as you're thinking about your problem and assessment work. Then it comes to prioritizing those problems, and we talk a little bit about magnitude, severity, trend, and changeability. And I'll show you in the next slide and then kind of ways to think about how you then prioritize that challenge or program. And then from there, going to risk and protective factors. And I've got some examples here of what those might look like. But first, on assessing the problem, that what, how often, and where, I have some examples here in that toolkit that you can use around how do you kind of answer those questions. So on the left-hand side, here's your problem. Maybe it's you have a high number of opioid overdoses in your community, or you have high levels of drunk driving accidents, or you have many students who are getting suspended because they're bringing vapes to school. Maybe marijuana use is higher than it used to be, and maybe the cultural norms around the health risks associated with marijuana use are changing in ways that are unfavorable to use, right? So you identify those challenges over here, your what, then your how often is when we start to use data in that assessment. So can you have any type of data that can help you explain and provide nuance to what that challenge is? And I've used these 4 different examples because I think they all are data sources that are different, right? So maybe you have somebody in your community that's doing opioid dashboard data. That might be your public health. Oh, sorry, I got ahead of myself here. To the point that was raised earlier, that might be your public health department that's doing that. But you might have county data on driving accidents that you might have to get from your sheriff's department or from the State Department of Transportation. School discipline data might come from the State Board of Education or maybe your local school district. And then you have a 30-day use indicator from a school survey. It might be a survey that your organization helps sponsor, or maybe another organization your community does that looks at substance use data at the school or at the child level, right? So the key point here is that when you're doing that assessment, it's important to look at empirical data from more than one source. Then we have that where, and this is where I think a lot of the prevention literature really wants to focus on where things are occurring, because that's how you can best bring together, especially when you're doing work on environmental conditions. How can we get a really strong understanding of the problem, right? If the problem is something that's really happening at home and alone, maybe you find that to be the case with vaping or opioid use or medication or prescription drug use. That might be more of a solitary activity. And so how you talk to youth about it, how you message it is going to be different from maybe a more social use like alcohol, which might be associated with prom and homecoming and other social events, or right? Those kinds of things. And I'm not saying that's the case in your community. That may look different in your community, but I'm just kind of using those as examples. When you're thinking about school and disciplinary data, like how do we message and have communication with youth in a school setting that might be different than in a non-school setting? Or talking about public spaces. So that where can be really important to think about and getting as specific as you can. Now, a lot of times you might not actually have data about where this is happening. And this is where I think the use of focus groups, key informant interviews, and other types of qualitative data that you're able to gather is going to help shed light on not just what the problem is or how often it happens based on kind of the big data that you have, but you pair that big data with your small data of what are youth actually telling you? What are youth actually saying about youth? What are parents actually saying are the problems that they're experiencing when they're trying to work in parenting with their child? And then lastly, we've got who. And so you can think about that geographically with zip codes and census tracts. You can think about that in terms of gender, males versus females. A lot of times what you see, I think, and forgive me for including this, but this should also really focus a little bit more expansively on gender as well, particularly youth who identify as transgender, LGBTQ. We also have two middle versus high school youth. So, how you approach those two populations being very different. And then also cultural group differences as well that you might want to be thinking about. So all these different aspects you want to really put in place. Then once you've identified that problem, it can be helpful to just think in terms of magnitude, severity, trend, and changeability. Now, I have these here in these charts just as more of a, for lack of a better term, a heuristic, really a tool that you can use to help guide your thinking. I don't recommend over-stressing about these. So when you're thinking about magnitude, severity, trend, and changeability, because you might not, you're kind of doing almost a little bit of an art versus a science in some of these. But to give an example of what that might look like, you might know that opioid overdoses, for example, or drunk driving accidents, maybe there's not that many of them in the community, but when they do happen, the consequences are very severe, right? So it's important not to dismiss work with opioid overdoses or drunk driving just because there's not that many of them in your community, because when they do happen, the consequences are so severe for you, right? So maybe you want to prioritize that. On the other hand, vaping or marijuana use may, in terms of its magnitude, be somewhat harmful in the near term. Harmful certainly in the long term, but maybe somewhat harmful in the near term. But so many youth are getting suspended, or so many youth are changing their attitudes around the health risks of marijuana that we feel like we need to intervene there. But again, how you make that decision between what's more important is going to be a little bit of you working with your team. And it's not going to necessarily be black and white in terms of how you go through that decision-making process. So I encourage folks when they see this in the strategic prevention framework, or you might see it with a grant maker who's asking you to complete a table like this, to not get too hung up on it, but to use it as a tool to say, hey, how can this tool help me do prevention work better? How can this help me prioritize which challenges and problems are better or worse in our community? In addition, you will see trend and changeability, right? So maybe we know that overdose is a problem, but maybe it's decreasing. And so we're happy that our existing communication efforts might be doing good work here. Whereas you might have something else like school discipline from vaping, it's going off the charts. You have your middle school principal who's calling you up and saying, hey, we had to suspend all these students here. Help us. We don't want to suspend our students. How can we help address this challenge so that youth stop bringing vapes to school, right? So you kind of have to use some of that qualitative data to make those decisions. And then lastly, things around changeability. I mean, we have to be honest that there are a lot of things that are going to drive substance use prevention that are really outside of what you can change, right? And so some things you can make a big difference on, some maybe are going to be harder to make a difference on. And so now how you quantify this, I think is super difficult. So that's where I think, don't stress about it too much. But maybe there's some things where it's kind of like, hey, this isn't going to be something that we can really make a big difference on. Maybe we don't have a lot of capacity here, or our community wouldn't respond well to this. So we need to focus on another area where we think we can make a big difference, right? Okay, so then after your prioritization, then you start to pick out your risk and protection factors. And for those of you who've been in this field, I'm sure you're very familiar with them, but if maybe these words are new to you, I do want to share kind of what these terms are and why they're so important when you're thinking about putting together grant opportunities, right? So first, when we talk about risk factors, what you're saying is what are things that are associated with a higher likelihood of developing a problem? So youth who have low impulse control, for example, youth whose friends use substance uses, youth who have challenging home environments, youth who have access to alcohol or drugs at their school community or somewhere else, that can be a risk factor for use, right? So what are all the things that contribute to it? Exposure to trauma and community violence can be a risk factor for substance use. Poverty is a risk factor for higher substance use, right? So these are things that we think about as contributors to developing a problem. At the same time, oh yeah, Kristen, that's a good example too, high density of alcohol outlets, right? So the geographic concentration of things happening in here. Chris mentions ACEs, absolutely. So adverse childhood experiences is a great thing to be thinking about, and how do we use kind of a trauma-informed lens to address those risk factors can be so important. So then we have protective factors. So what are the things that are associated with lower likelihood of developing program? So academic achievement, parental bonding, family cohesion, mentoring, access to additional resources in your community, being able to sign up for a youth program, being able to do alternative activities like sports and drama and other types of youth activities that put youth in safe places that are drug-free, right? So those protective factors are also really important. So the key here, I think, is that sometimes there can be a temptation to overemphasize the risk factors, because in many cases, your organization is going to be providing protective factors. That's what you're going to do. There's cultural norms say that marijuana use isn't that big of a deal. There's not a high risk with that. So then you put together a communications command that talks about the risk of it. That's your protective factor, right? Or maybe there aren't enough youth programs in your community that help youth have things to do on Friday night other than, using substances. You provide that program, right? So thinking about those protective factors, I think, is really important, using a strengths-based lens to say, this is where we're going to find our solutions to the challenges and risk factors that we see. You might not be able to change the fact that there's a high level of poverty in your community, or that there's really high rates of inequality that have disenfranchised. You might not be able to change the fact that there's a housing market that's terrible and that is really making things difficult for families. Those are hard to change, right? But what are things you can change? And kind of focusing on those protective factors, I think, can be really, really important. So let's talk about some examples of risk and protective factors that you focus on. And I wanted to do this, just kind of do a bit of community brainstorming, because I love to see what other people are doing, because people come up with so many different ideas. So maybe take a minute here. What are risk or protective factors that you focused on when you have been working in prevention? And add some into the chat, or if someone wants to raise their hand and share, they can welcome to as well. Occupational stress, that's a good one there. High rates of mental health systems. I'm glad you mentioned that. The connection between mental health, absolutely huge, right? Coping skills, perfect, excellent. I just got to know that we got to keep moving here. I'm running low on time. All right, keep adding them in here. Hypertension, this is great. Incarceration, family bonding, bullying, and self-advocacy, the great ones. Infant mortality, good examples. Keep adding them in there and take some notes. And maybe you can try and look at a risk protective factor that you haven't explored before to talk to it as well. All right, I got to keep moving. Sorry, I'm realizing I have more to do here. So in your assessment, also making sure that you're taking a look at capacity and readiness, right? Because you might not necessarily have all the capacity to tackle something, even if there is a problem in your community. So sometimes maybe now isn't the right time to tackle a challenge because you don't have the capacity needed, or you need to ask for it in that grant opportunity. I'll skip by here. This is more information here too on providers, and always making sure that you're kind of building those connections with new folks you can bring into the conversation. That next part in the toolkit talks a little bit about capacity, recognizing that no organization does it alone. So taking a minute to kind of brainstorm a little bit about what are some of those different organizations and how you can build that network. I'm going to skip ahead here a few, because I think most of these we've talked a little bit in some capacity before, and I want to get to a few things towards the end. Sorry, I'll come back to here to planning. So in planning, you want to talk a little bit too about how you intend to plan as a community. How do you intend to address these challenges as a group? Engaging your community through workshops and town halls, identifying leaders who needs to be at the toolkit, or sorry, at the conversation at the table, right? So in here in this planning document, you can kind of put together some ideas like, what are the existing things that you already have? Do you have a logic model that you put together a year or two ago? Does it need to be updated? What about a strategic plan for your organization? How can that inform the work that you're doing, or a theory of change? planning to plan. So what are the activities that you can take to focus on with planning, and how you can kind of think through some of those things as well to include them in your grant writing approaches. In implementation, I have a slide here on implementation to think about also making sure that we are mixing up both our individual and environmental conditions, right? And some of your grants might really want you to focus just on environmental and some on just individual. I think most organizations are pretty good at providing a program or a service to a parent or a youth or a child. It's sometimes harder for us to think about saying, hey, what if we change the laws around alcohol distribution in our community, or the sale of alcohol in our community? What if we actually change the physical environment of a local park where we know a lot of substance use is occurring? Those are the harder things to do. But I think it's important during that grant writing process to say, like, again, what if? Brainstorm, what if we change some of the things that we know environmentally contribute to substance use issues? So always making you think about both individual and environment when putting together some of your things. I'm going to skip this one on environment because we're running a lot of time. Lastly, on our checklist, we talked a little bit about evaluation, and we'll spend more time in detail in 2 weeks when we talk about this in more detail. But I want you to think just a little bit about, at the very beginning, thinking about both outcome and process evaluation. So having some way of capturing the results of what you did, identifying your outcome indicator. Maybe it's 30-day use. Maybe it's changing perceptions around risk of a substance, or maybe it's the number of suspensions in a school district, right? Thinking about what some of those core outcomes are and tracking those, but also tracking your process. You know, if we said, hey, we were going to serve 60 youth, did we serve 60 youth? What changed along the way? What did we learn about what we thought was going to be a good idea in this grant application, but what actually happened when we actually implemented it? So kind of keeping both of those forms of evaluation in mind can be really important. How you're tracking outcomes and outcomes, measuring them, tracking data, and protecting data and participants. And again, we'll talk about this in more detail, so I'll skip ahead for today. So in the toolkit, you have some ways to kind of think about some questions to kind of guide your thinking on that. You know, who on your team can do evaluation work, and can you incorporate them into the grant writing process? They can help you write the evaluation section. You know, what are some things that you can think about with both process and outcome? Whew, I'm sorry, Chris, I'm running a little bit. I gotta go quickly here. Sorry, folks, if I feel like I'm talking too fast. Recommendations on writing. First is start outlining and writing right away. Set up that recurring weekly meeting, as I shared previously before. Prioritize grant writing briefly over your regular tasks. This is a hard one because you're going to get something in your email that says you need to do something urgently, but you know you need to do this long-term grant. Set aside a time. Prioritize it. Block off an hour where no one's allowed to email you or call you, and you're just going to write to make sure that you get a chance to do it. Section 7 on engaging community members in collaborations. I'm going to skip to this section here real quick, just because I want to cover a few things, and maybe I'll pause after this for questions. I want to share just about collaborations, and I alluded to this at the beginning. You really want, good collaborations have full commitment of leadership of multiple organizations, not just yours, but somebody else's as well, right? A shared set of mission and alignment with goals. And the planning happens comprehensively and together from the start. And I can't emphasize that enough, right? Bring folks on to a project or a collaboration as early as possible and do the work with them, not for them or alongside them. Do it with them. And that is going to change everything from how your grant comes together to your actual implementation. Making sure that you're sharing the risk, that both organizations or multiple organizations have the same skin in the game. And that resources are jointly secured. So a couple things on collaborations there. All right, lastly, I do have an example in here of a letter of commitment, just in case you're looking for one. One thing I recommend is make it easy. If you've worked with another organization and you already know what the shared goals are and what they're going to commit, write the letter of commitment for them and send it to them on DocuSign so they can sign it quickly. It'll save you tons of headache and you'll have clear what it's looking for, right? Here's an example of what that might look like for a letter of commitment, and some things that you can fill in. One thing that I'll mention here is that it says to support the efforts of this grant, our organization commits to listing out what they're committing to do. We're committing to host a youth group once a week at our organization. We're committing to providing a social worker who's going to provide case management services. We're committing to helping with the communications campaign and blasting everything on our social media. Whatever it is, listing it out specifically so that it's very clear to the organization, to you and to them, what they're being asked to do if it comes together. And with that, I think I'm probably out of time. So I'm going to pause for questions. You can drop them into the chat or raise your hand and we'll take some questions.
I noticed that the questions that came up in the chat, you did a pretty good job of addressing them right away. I want to say thank you, Drew. That was awesome. A lot of good information, and I'm really looking forward to seeing that toolkit. What I loved is you mentioned, you like sort of said it in passing, that really that's the art of it. And there really is a science and an art to grant writing. You share a lot of the science or the best practice, but you really do give a lot of nod to the art of grant writing, which I think that's where grants are won, when you successfully are artistic and creative in how you incorporate other voices and other partners. So that just struck me because I love talking about the art and science of lots of things that we do.
Yeah, it's true. And I think sometimes we get hung up on it because you want it to be perfect, and you feel like you get so come up with the checklist of things that you have to fit that you feel like, oh, I can't do this, or like I'm not an expert in this, or I can't make these decisions. And the thing is no one's asking you to do anything that you're not capable of doing. Just make the best information decisions that you can with the information that you have. That's all you can do, right? And then just hope for the best.
Yeah. I think as a reviewer, I find when it's very clear, and I can draw an easy line from the problem to what they say they're going to do, and I always go back to what were they originally supposed to write for. Just keep it, the simpler you can keep it. It's so easy to tell when people have just thrown in a lot of fluff that's really not at all connected. It wasn't what the grant was asking for. So keep it simple, sweetheart method, that KISS method, I think is also helpful.
Absolutely. Kristen, some folks have asked how they can sign up for the next 2 webinars. Can you share a little information about that?
Yeah, it's on the Southeast PTTC website. So if you go to I'll put it in the chat, pttcnetwork.org/Southeast. If you go to our website, you'll see there are 2 more webinars in this series. So you want to go and make sure you register for those. The recording is going to be available on our YouTube page. If you go to YouTube and search Southeast PTTC, it'll come up. Make sure you click subscribe and follow, because all of our past webinars, almost all of them, are on there. You can download these webinars. You can share them with your coalition or partners. All of this is funded by your tax dollars. So use this information that we're providing to you. We are going to follow up. The Southeast PTTC, we're going to make sure to email all attendees today a reminder of the evaluation. I will get the link for the toolkit and make sure that you guys all have access to the toolkit. So you'll go to Drew's website, Common Good Data, sign up, and you'll get access to that. I'll get the slide deck and a PDF of the slide deck, Drew. I'll make sure that I get that to you. That'll also be on our website. Yeah, I don't know if Leonard, if you're still on, if you can put a link to the YouTube. It's on the bottom of the Southeast PTTC page. If you go to that pttcnetwork.org/Southeast, down at the bottom, the link will take you right to our YouTube page. I'll put that in the follow-up email as well. So all of you guys who attended today, and even the people who already left, I'm going to make sure to send out an email with everything. So don't worry about it. I know how important all this information is and that certificate. So Drew, thank you so much for today. I'm glad we were able to get your slides going, and I look forward to seeing you on, is it June 3rd?
That's right, June 3rd, same time.
Noon Eastern time, and then 11 Central, 10 Mountain, 9 Pacific. Make sure you sign up and join us. So I hope this kicked off your week in a really thought-provoking and positive way. Take care of yourselves this week, and we'll see you all back here on June 3rd.
Thank you.
You
Thanks,
bet.